Good afternoon and welcome to the City of Toronto's COVID-19 media briefing for Wednesday, May 19th, 2021. Joining us today is Toronto Mayor John Tory, Toronto Fire Chief and the General Manager of the Office of Emergency Management, Matthew Pegg, and Toronto's Medical Officer of Health, Dr. Eileen. Mayor Tory.
Well, Brad, thank you and good afternoon. Before I deal with some COVID-19 matters, I'd like to say a few words on another very important subject. I know that there are people in our city right now, many people in our city, who are deeply concerned about the situation that we see in the Middle East. The violence there is deeply upsetting to see, and we all want to see a peaceful resolution reached as soon as possible. Here in our city, there are people who would describe themselves as pro-Israeli. There are other people who would describe themselves as pro-Palestinian. I know many of them, and they all hold their views founded in many cases on a fear for their loved ones, and they feel very passionately about this issue. My job as mayor is to make sure that here in our city of Toronto we avoid conflict and violence, even when it rages in other parts of the world where we have many friends and loved ones of our residents here in the city of Toronto. I want to send a clear message today, ahead of any future protests about this issue, that hatred, threats, hateful language and imagery, physical violence against anyone on any side of this or any other issue has no place in our city. Hatred has no place in our city. Islamophobia has no place in our city. Anti-Semitism has no place in our city. Our Jewish and Muslim residents and all residents without exception have the right to live and to worship in our city free of fear and free of being attacked or threatened for their beliefs or for who they are. Over the last few days, I've had the opportunity to speak with leaders of the Muslim community, of people interested in the Palestinian cause, and people who are leaders in the Jewish community, to reiterate my commitment to them as mayor and my position that there is no room for hatred or violence or discrimination of any kind in this city directed against anyone. Over the years, I have stood outside mosques and synagogues and in other places repeatedly to make sure that when there were incidents of vandalism or violence or any kind of hatred or discrimination, that we spoke up and that we stood up and that we acted against that. I will never hesitate to do that because I feel very strongly that is my job as mayor and it is my duty as a Torontonian to stand with communities when they are victims of hate and to make it clear that we do not tolerate that here. I know Chief Raymer believes that as well, and while the police do work to make sure that protests remain peaceful and orderly as best they can, they have also made it clear they will investigate any allegation of violence that comes to light during or around a protest and any implication that such a crime was hate-motivated. We await the results of the investigation into at least one event related to the Nathan Phillips Square protest. None of this is to say that people can't disagree or voice their concerns publicly. Of course, those are cherished rights. Everyone in Toronto has the right to protest and to participate in peaceful demonstrations. That is at the foundation, the very foundation of our democracy. During the pandemic, people are urged not to gather to protect their health, in order to protect their health and the health of others. But as we saw last weekend, people gathered to protest and to raise awareness. The vast majority of those protests were peaceful, as has been the case with many other protests during the entirety of the pandemic. That is the way it should be. That is, by and large, the way it was last weekend. Thousands of people demonstrating peacefully. So while we encourage people not to gather right now due to public health concerns, I would repeat again, if you do protest, please do so peacefully. We will not accept, and we cannot accept, any acts of hatred against any community. I wanted to say this today to send a clear message ahead of any protests that may come, and because I believe we must make it clear. We must make it clear to everyone, mostly just to ourselves, to each other, that violence by anyone, against anyone, or any community in our city cannot and will not ever be accepted. On the subject of COVID-19, Team Toronto has now distributed more than 1.79 million doses of COVID-19 vaccine in the City of Toronto. All Toronto residents 18 years of age and older are now eligible to book vaccine appointments through the provincial booking system. Given the increased numbers of people who are eligible, which we support, we are working to get everyone vaccinated within that expanded group. As you know, with the assistance of the province, We were able to open up 120,000 new appointments yesterday in the coming days and weeks. Thanks to additional vaccine supply, we will be ramping up our capacity at city-run clinics this weekend for a long weekend dose drive. This Victoria Day weekend, you can help make sure this is the last long weekend in lockdown by getting vaccinated if you haven't already. We are working to open 19,708 new appointments in our clinics. That's 4,927 new appointments on each of Friday, Saturday, Sunday, and the holiday Monday. 10,000 new appointments are also being added to the city-run clinics for next week as well. These appointments will be live at 4 o'clock this afternoon, and so I encourage people to go to toronto.ca/COVID-19 to book their appointments. As you know, the city-run clinics are just a part of our overall vaccination effort, the Team Toronto effort. 39 clinics are being operated in total by Team Toronto across the city today, many of them by hospital and healthcare teams who are our partners in Team Toronto. I want to thank, for example, the Scarborough Health Network for hosting a vaccine clinic today for TTC workers at the Malvern Bus Garage, operated by the TTC. I want to thank as well Women's College, North York General and Michael Garron Hospitals for offering frontline TTC employees on-site access at their premises to vaccinations, and to the community clinics who are also offering TTC employees priority access. These TTC clinics have resulted in more than 1,000 first doses being administered to frontline TTC employees, with more on-site clinics in the works for the coming days and into next week. Pop-up and mobile efforts for members of the public will be going strong through the holiday weekend, and I want to, in advance, thank all of those involved in making those clinics such a success. Their staff and volunteers, healthcare professionals, and others, and they are helping make sure these clinics are successful. I want to applaud the East Toronto Health Partners for planning a drive-through pop-up COVID-19 vaccine clinic for seniors 65 plus at the Warden Station North parking lot on Saturday. That drive-through pop-up will be administering about 500 doses to seniors and to their caregivers who drive them there. I'm glad the TTC was able to provide the parking lot. Again, another example of Team Toronto at work. It's another good example of how every single part of this city government is mobilized to make sure this vaccination program can be a success. We're also working to get young people 12 to 17 years of age vaccinated. Dr. Davila will have an update on the Youth Vaccination Working Group today, and it's important to work to get our young people vaccinated so that they too are protected. The work of our Team Toronto Sprint strategy is also continuing and having tremendous success. This strategy focuses on getting as much vaccine as we can administered in 22 of the hottest hotspot postal codes in the city by our hospital and healthcare partners in cooperation with community organizations on the ground. Overall vaccination coverage in the 22 priority postal codes is now at 56.6%. This week, we're expanding the Sprint strategy to 7 new postal codes, including 4 in the Northwest, 2 in the East, North York and Scarborough, and to the M5T postal code, which includes parts of Kensington Market, Chinatown, and Alexandra Park. The downtown postal codes that were added to the Sprint strategy on May 12th saw sharp double-digit increases in the percentage of people aged 18 and older who have received at least 1 dose of vaccine. The M3J postal code, which includes York University Heights and parts of Jane and Finch, 88.6% of those aged 18 to 24 have initiated vaccination, higher than any other age group in this postal code, and the highest for this age group across all 22 of the priority hotspots. These numbers show that the Sprint strategy is working, that it was and it is the right thing to do because it is helping us to get the right shots in the right arms at the earliest possible date, and that in turn will make the biggest difference in our fight against the spread of COVID-19. While I'm confident that we will make the kinds of threshold levels of vaccination we will likely need to move to a more open status as a city, it won't be without collective effort. Having more than 60% of eligible people in Toronto vaccinated on a first dose basis is a solid achievement in a short time. But if you look at the kind of threshold numbers put out there by public health authorities, by other provinces, and indeed by other countries, you know that we have to continue to push that number up to at least have a 7 in front of it, and that means that we have much more work to do. But I know that together, Team Toronto and all of you who are part of the broader, bigger Team Toronto, we have what it takes to get that done. And now it's time for Chief Pegg's report for today.
Thank you, Mayor Tory, and good afternoon. To date, more than 1.79 million doses of COVID-19 vaccine have been administered in Toronto. With nearly 25,000 doses of vaccine administered yesterday, we are continuing to ensure that as many people are being vaccinated as possible each and every day. As Mayor Tory announced earlier, I'm very pleased that we are opening approximately 19,000 additional appointments in city-operated clinics over the course of the upcoming Victoria Day long weekend. This means that nearly 5,000 additional people will be able to receive their first dose of vaccine each day between this Friday and Monday in city-operated vaccine clinics. And this is in addition to the increased number of doses that our Team Toronto partners will also be able to administer this weekend. I would like to acknowledge and thank our provincial counterparts for making these additional doses of vaccine available. I would also like to thank our immunization task force team for working through the night twice this week so far in order to develop and load the vaccine clinic load templates that make it possible for these additional appointments to be able to be booked. These are incredibly dedicated people who continue to give their all to get Toronto vaccinated as quickly as possible. The additional supply of vaccine this Victoria Day long weekend returns our 9 city-operated clinics to maximum operating capacity. Over the course of Friday through Monday, we will be able to vaccinate approximately 56,000 people over those 4 days alone. These additional appointments will go live in the provincial booking system at 4 o'clock this afternoon. As always, appointments in city-operated vaccine clinics can be booked via the provincial booking system by accessing toronto.ca/COVID-19 and clicking on the blue Book a Vaccine button on the top of the page, or by calling the provincial call centre at 1-833-943-3900. I want to remind everyone who has booked an upcoming appointment in a city-operated clinic that should you wish to take advantage of the additional appointment availability by booking an earlier appointment, you can do that by accessing the reschedule link that is included in your appointment confirmation email that you received when you made your original appointment booking. You can also reschedule your appointment by calling the provincial call centre, again at 1-833-943-3900. I'm also very pleased that we are opening an additional 9,720 appointments in city-operated clinics between Tuesday and Sunday next week. These additional appointments will also be available on the provincial booking system at 4 o'clock this afternoon. Since 8 o'clock Monday morning, more than 37,000 people have booked their appointments in city-operated clinics. As of 1:30 this afternoon, there are approximately 149,850 first dose appointments still available in city-operated clinics between today and July 4. I encourage everyone who is 18 years of age and older to book your appointment to get vaccinated against COVID-19 as soon as you are able. I would also like to provide some clarity on a frequently asked question that we are receiving with respect to eligibility for those between 12 and 17 years of age. In order to be eligible to receive COVID-19 vaccine as a youth, you must have actually reached your 12th birthday on the day that you receive your vaccine. The province of Ontario has advised that youth between 12 and 17 years of age and their family members who have not received a vaccine will be eligible to book an appointment for their first dose of the Pfizer vaccine at mass immunization clinics beginning the week of May 31st. We are awaiting the details as to when and how this expanded booking system eligibility will be made available, both online and through the provincial call centre. Some of our Team Toronto partners are already making vaccine available to youth who have reached their 12th birthday. Please go to vaccineto.ca for vaccine opportunities that may exist in Team Toronto partner clinics. For those active on social media, I encourage you to follow Vaccine Hunters Canada on Twitter for additional information on opportunities to receive COVID-19 vaccine in Toronto. Thank you for all you do to help stop the spread of COVID-19 in our city, and please continue to monitor toronto.ca/COVID-19 for the most up-to-date information on immunizations in Toronto. I will now invite Dr. Davila to bring her report.
Thank you, Chief Pegg, and good afternoon. Before I commence my remarks, I just want to note that today is Personal Support Worker Day, a day to acknowledge and celebrate the contributions of personal support workers, or PSWs, everywhere. Whether in acute care, long-term care, or in community settings, PSWs provide important daily support and services to their patients with empathy and with caring. Their contributions throughout the course of the pandemic have been truly invaluable, and for this, we owe them our deepest thanks. Today, I'm reporting 751 new cases of COVID-19. 1,018 people are in the hospital. 263 people are in the ICU. I'm saddened to report 9 additional deaths today. Looking at the numbers overall, though, we see signs of hope. And as we move now toward better times, it can be easy to forget the price paid over the course of the pandemic. But I was reminded this morning of the seriousness and the suffering from COVID-19 when I looked at the cumulative case count and the hospitalizations in Toronto since the pandemic began. More than 158,000 people in Toronto have been infected with COVID-19. 3,285 people have lost their lives, and more than 10,000 people have been admitted to hospital. With all that in mind, today I really want to encourage you to be vaccinated, now that so many more people are eligible. Since yesterday, everyone aged 18 and up is eligible to book a COVID-19 vaccination appointment. Additionally, 12 to 17-year-olds can now be vaccinated at certain pop-up and mobile clinics, which began piloting this week. Thank you to the amazing healthcare partners who are delivering this access on the ground in the many communities that make up Toronto. There will be more over the course of the next few weeks, and that planning is underway in earnest and ongoing between Toronto Public Health, the Hospital for Sick Children, and other healthcare leaders. As of May 31st, 12 to 17-year-olds will be able to book appointments through the provincial booking system to access vaccine through city-run immunization clinics and clinics based in a number of hospitals. And for the weeks of June 14th and 21st, there will be appointments dedicated to youth vaccination. In time, the widening of eligibility will make a tremendous difference in the number of people with their first vaccination. This increased access also creates a significant number of people all in pursuit of the same thing, vaccination. That may create frustration for anyone who wants a vaccine, but finds that they have to wait a while because of the demand. I recognize there may be more demand than vaccine supply at various points right now. I do hope that the demand persists until every resident is vaccinated, especially with the growing evidence of the protective power of vaccines. Some people have asked me why there's so little talk about the Moderna vaccine. And to that I say this. Scientists and doctors around the world are confident in the Moderna vaccine's ability to protect against COVID-19. But studies have tended to focus on Pfizer and AstraZeneca because these vaccines were available in greater supply in the first half of this year. I would anticipate that we'll see more studies, including Moderna, in the months ahead. I know the University of Oxford's study of a mix and match approach to two-dose vaccination now includes Moderna, after originally focusing on AstraZeneca and Pfizer. And in that respect, yesterday there was a study released out of Spain that found the AstraZeneca and Pfizer vaccines can be safely and effectively mixed as first and second doses. Canada's Chief Public Health Officer, Dr. Theresa Tam, said yesterday she expects Canadians will have a choice about their second dose if they got an AstraZeneca as their first. Things change regularly on the vaccine front. Supply arrives, appointments are created, vaccines are administered, and antibodies build in more and more Torontonians. So I will close with two challenges to you today. First, I really do encourage you to talk about vaccination this weekend. If you've done it and you've got a story to tell, please tell it. Encourage people to follow your lead, whether you're vaccinated or you're planning to be. At the same time, this is a holiday weekend coming up. And if I'm to be completely candid, our track record after holiday weekends could use some improvement. At the Board of Health meeting earlier this month, I noted that after every holiday weekend over the last year or so, we've seen an increase in COVID infections. That is the last thing we want, considering variants that are afoot in Toronto, and that there's still a significant number of people with no vaccine protection at all. So please, this weekend, do get outside. Enjoy the weather. Be safe. And remember, there's more at stake this holiday weekend than perhaps there has been for a very long time. Our summer lies ahead, and in it, greater opportunity for more and for better. We all play a big part in making this happen. And the biggest part is what we do day by day until we get to where we want to be. So with that, I'll hand it over to Brad for the questions.
Thank you, Dr. Davila. We'll go first to Dave Woodard from Global News Radio 640, and just a reminder to please unmute yourself. Dave, go ahead, please.
Thanks, Brad. Good afternoon. Dr. Davila, my first question is for you. With the Premier's office confirming yesterday that they're not going to go back into a color-coded framework for reopening, have you had conversations with the province on what reopening will look like? And in your opinion, what shouldn't be open, and is that something that you're going to try to keep closed regardless of what the province decides?
So as you've probably heard us speak of many, many times at this table, we are in regular conversation with our provincial counterparts. And this has been the case throughout the entire pandemic, as that's been what's required over the course of the response. I would say this, I think when we have those conversations with the province, one of the points that I regularly try to make is the importance of relying on our data and relying on the science and relying on the lessons that we learn from jurisdictions that are a little bit ahead of us. So I would say this, I think you've heard me talk about, taking advantage and using the good weather and this time of year as an ally in our efforts to reopen, and to use the experiences from other jurisdictions to help inform what it is that we do here so that we open safely and in a manner that actually keeps the COVID infections at a reasonable level and at a controllable level. We are at a very important time, I think, in our COVID response, and we need to rely on our data and the best available science to put us in good stead.
Okay, thank you, Dr. Davila. And a question for Mayor Tory from my colleague, Catherine Ward. In April, the action around the enforcement of evicting residents and encampments was paused. At that time, city officials said that they would be working with residents in the communities, encouraging them to come inside. The question is, why has the city decided to start enforcing these orders, given that many don't feel safe going into shelters for fear of COVID-19? And are you worried that these evictions could worsen the opioid crisis by forcing people to flee to remote parts of the city?
Well, the opioid crisis is something that is of deep concern to me, and I've said that on a number of occasions, and have worked with Councillor Joe Cressy, the Chair of the Board of Health, with Dr. Davila and others, and we continue to work together to find ways in which we can deal with that effectively, and anything I could do to make sure that this terrible loss of life and the terrible toll taken on the lives of those who don't lose their lives will be something that I will do. But let me address very specifically the issue of encampments. I'm very committed to taking steps that we need to take in order to reduce the number of encampments. And I understand the fact that no one would seek to be homeless. But I will say that the encampments are unsafe, they are unhealthy, and they're illegal. This very encampment where there was some activity taking place today was an encampment where we had a fire recently, and only because outreach workers happened to be there in the night was a man rescued from a tent that moments later exploded. And so there comes a time when, in the case of this encampment today at Lamport Stadium, the street outreach workers have visited that encampment 107 times in 2021 to offer housing indoors, safe housing indoors, to people who are living in that encampment. Those places we would offer to the people experiencing homelessness to go have been the subject of an intensive effort by the city to increase infection control activity, to make sure that we stepped up the pace of vaccination of the residents who are in those facilities, and to make sure they're otherwise safe. And it accompanies an unprecedented wave of action taken by this city government in respect of supportive housing. And so there does come a time when we have to take some action in this regard and establish that we cannot have people living continuously in unsafe, unhealthy, and illegal circumstances in our public parks. And I will say that I find it profoundly unacceptable. There were by best estimates, about 15 people resident in the encampment at Lamport Stadium when the officials arrived there after plenty of notice to try to clear that encampment. Some of them had agreed to accept indoor housing, but there then seemed to be many more people materialized there, and they engaged in activities that resulted in the assaulting of police officers, the throwing of bottles and rocks, and I find this unacceptable in our city. Unacceptable. I don't know who the people were exactly, but it was just not acceptable. So we will go back at the efforts we're making to make sure that the hotel and other shelter accommodation we provide for those experiencing homelessness are as safe as they can possibly be. And we will continue to operate in a way that has many, many visits to these encampments to persuade people that they should come in. But the notion that we're going to leave encampments there indefinitely that are unsafe, unhealthy, and illegal in public parks and public spaces is just not something that we're going to be able to do. And so we would hope that people will be able to cooperate with us in finding a solution for them. Many thousands and hundreds of people, thousands and hundreds, have been found permanent housing and have been moved from encampments to shelters and sometimes on to permanent housing in many cases during the course of the pandemic, and that work will continue.
Thank you, Mayor Tory. We'll go next to Maria Saru from the Toronto Star. Maria?
Hi, everyone. Good afternoon. My question is, how was the decision to add parts of Kensington Market and Chinatown to Toronto's Sprint strategy made?
So Maria, I'm probably best positioned to answer that question. What we have done in terms of determining the Sprint strategy and which areas of the city need to be focused on next is we actually look at the coverage data. We look at vaccine uptake data across the different parts of the city. And whether it's done by the postal code areas or by the neighborhoods throughout the city, we do look at what the coverage rate is and what the COVID incidence has been. And it's the combination of those two pieces of data that help us to inform how best to situate vaccination efforts on a go-forward basis. So that's the basic answer to it. Again, it's all about where does vaccine have yet to be taken up appropriately, and where do we expect that our efforts will have a benefit in terms of offering better protection to the people of Toronto.
Thank you. Just one follow-up. How nimble can the city be moving forward when determining which neighborhoods will be added or removed from its hotspot list? How much flexibility does the city have? Thank you.
So Maria, in answer to your question, we have a fair amount of flexibility, and it is something that we do in concert with our healthcare partners. But I would just remind you that, of course, while our mobile and pop-up efforts as part of the Sprint strategy form an important part of our vaccination efforts, there are vaccine channels available to the residents of Toronto that go beyond those mobile and pop-ups. As you know, we have a number 9 city-run immunization clinics. There are pharmacies, an increasing number of pharmacies around the city, and now a growing number of primary care providers over and above hospital clinics and the mobiles and pop-ups as venues where people can get access to vaccine. So I would certainly encourage all residents of Toronto to find the channel that's easiest for them to access and to take advantage of the protective benefit of vaccines for themselves and for all those around them.
Thank you, Doctor. We'll go next to Nick Poivert from CBC News. Nick?
Hi, thanks, Brad. A question for the mayor and Dr. Davila. On the hockey playoffs, Leafs and Canadiens starting up tomorrow. Game 6, if it gets that far in Montreal, there could be up to 2,500 fans when the Quebec government lifts some of the restrictions. Do you think that could be done safely here in Toronto, either at some point, maybe Game 7, say, during this series or later on in the playoffs?
Well, the circumstance here, if I can start off, the circumstance here might be a bit different. We have in place a stay-at-home order that severely restricts crowds of people from gathering together, and that we've received every indication that that order will stay in place until the date it is due to expire, which is at the very beginning of June. And so this current hockey series is scheduled to be over by then. And I think that it'll be obviously a provincial decision on which they've generally sought input from people like the City of Toronto. And it'll be part of, I'm sure, a much broader consideration of different things that will be open and closed if that order expires on schedule, which they've indicated it likely will, and be replaced by some sort of reopening plan, which I hope is simple and straightforward and will answer questions like this. And I'm sure we sit ready, and Dr. Davila will pick up on this, I'm sure we sit ready to offer our advice and our comment on this, as we have on many other matters concerning public gatherings and different venues that have been impacted upon by the pandemic.
So the mayor is quite right. Right now, there is still a stay-at-home order that would prevent such gathering from happening. And certainly I understand the interest of hockey fans everywhere in celebrating and in participating in the festivities. I would just remind people, of course, as I mentioned in my remarks, we have, a real opportunity to enjoy a wonderful summer and, a post COVID restriction kind of life. And that really does depend on each and every one of us. And it depends on all of us following the best available science that's out there. So we know that outdoors is definitely safer than indoors, and that as much as we want to be able to gather together, that for now, it is best that we maintain our distance, wear our masks when distance can't be maintained, to get your vaccine as soon as possible. And the more we're able to do that, the sooner we'll be able to get back to the kinds of activities and the kinds of gatherings that we used to enjoy more often before there was a COVID-19.
And Dr. Davila, if the provincial government does at some point move to allow some indoor gatherings the way that they're doing in Quebec, can you just describe some of the measures that you would like to see in place, say in an arena where fans might attend? What are some of the ways that you think that could be done as safely as possible if it is to happen?
Well, looking at the evidence that's out there in respect of COVID-19, things like ventilation, things like maintaining distance, things like wearing masks are certainly going to be elements that the provincial government should consider as they think about what the next steps look like. I think we should turn to the experiences of other jurisdictions. There are a number of jurisdictions that are just a little bit ahead of us in respect of their own COVID-19 experiences, and I think there are valuable lessons to be learned from that. So those are the kinds of things that I would recommend should be looked at and should be taken into consideration as the provincial government makes their important decisions in this regard.
Thank you. We'll go next to David Ryder from the Toronto Star. Dave, go ahead. There you go.
Hi there. Yeah, thanks. A question, I think, for both Mayor Tory and Dr. Davila, and that's with the province looking at reopening, how important or not important do you think it is for the Greater Toronto Hamilton area to open up at the same time, as opposed to having, as we've had in the past, sort of a patchwork quilt of some places being reopened with indoor dining and other places being totally locked down?
I will offer an obviously non-medical opinion in this regard, and just say that I believe that the degree to which we can have a consistent set of rules for this region, which operates as one market in many different respects. It's a media market where people get their information from the same media, so when they hear conflicting reports as to what's going on in one place versus another within the same region, it's confusing. It operates as a sort of an economic and mobility market, in that as people move around, if there are different rules in place, then you are sending mixed messages to them as to what they should do, and making available the opportunity for people to move back and forth and contribute to the spread of this virus. And so, to me, whatever the rules are should be applicable to the entire region, because it very much operates that way. People live their lives that way. They go to and from work that way. They even do things with their families that way. And so I'm hopeful that, at the very least, that the region will be treated as one, and that the province can come up with rules and other reopening measures that will be consistent and will be broadly accepted as being appropriate in the entire region.
You know, the mayor made note of the fact that his thoughts may not be all that medical, but in fact, you know, as important as the medical science is around decision-making when it comes to COVID-19, fundamentally, I think the decisions that we're talking about now in respect of reopening are largely around human behavior and how people live, work, and play in the Greater Toronto and Hamilton area. So I concur entirely with the mayor that it has to be practical, it has to be readily communicated and understandable to, you know, the large swath of the province's population that lives, works, and plays in this Greater Toronto and Hamilton area. And, you know, I think that that's going to be a very important component of that which the province puts forth in their reopening plans.
Thank you. And I think my second question is for Chief Pegg. And that's, Chief, when we spoke last Friday, there was some concern with how wide the province would be opening vaccinations and how much supply the city was getting, especially with that deep drop-off after the end of the hotspot top-up. I'm wondering if you can give us an update. It seems like the city is opening more spots, although they're small compared to how many people became eligible. Have you received any idea of how much vaccine we'll get next week? And is there still a concern that some newly eligible people will be trying and not be able to get an appointment because there just aren't enough spots?
Hey, good afternoon, Dave. So obviously really good news has come to us a couple of times this week now. Obviously, firstly, we were able to open additional appointment blocks for three week-long periods in June, which certainly afford a considerable number of people the opportunity to book their appointment. And then, of course, only a day or so ago, we were informed of the opportunity to expand our clinic operations this weekend, and then again to add a significant number of additional appointments next week. So our teams were able to go to work very quickly and put those, make those changes, put them together, and get them loaded into the system. And like we talked about this weekend, the additional appointments this weekend, as well as the additional appointments next week, will be able to be booked just a few minutes from now at 4 o'clock this afternoon. So that's fantastic news. I really do appreciate, we all appreciate, that the province of Ontario continues to do everything they can do to make additional vaccine available to us and to make as much vaccine available. Undoubtedly, there just by sheer math, there are more people eligible for vaccine than there are currently vaccine appointments in our system. But I will remind everyone, Dave, that as you and I talked about last week as well, the 9 city-operated clinics, while that does form and has from the start formed the backbone of clinic operations across the city, it is only that. And that means that it is augmented and supported by a growing network of partner-operated clinics, pharmacies, primary care physicians that we're seeing literally every day with tens of thousands of doses being administered. So next week, I don't have any additional visibility than we had before as to what next week looks like, but certainly if there's one thing that has held true for the immunization task force team throughout this vaccination effort is that these are things, and vaccine supply is something that changes very quickly, and it is the reason that we continue to work so hard to make sure that as a city we are able to respond in a very nimble, very prompt manner to make sure that we can we are able to take advantage of every vaccine dose that is provided, and I'm proud of the fact that we are. So we'll continue to monitor very closely, and I'm sure our provincial colleagues will continue to do everything they can do to provide as much vaccine as possible.
Thank you, Chief Pegg. Final question this afternoon is to Natalie Johnson from CTV News. Natalie, go ahead, please.
Hi, Brad. My question is for Dr. Davila. Dr. Davila, I'm curious to know what your opinion is of Torontonians going south of the border for their vaccine, either because they can get their first dose sooner there, or in some cases their second dose sooner at a reduced interval.
So, Natalie, I would say this. One, I continue to be heartened that there are a number of Torontonians who express an interest in getting vaccine and are demonstrating that interest by voting with their feet. I would also, though, suggest that at this point we are and continue to be under a stay-at-home order, and the fundamental of that is to minimize movement and to minimize interaction and travel outside of your home, to stick to the people that you live with, to keep it to that which is most essential at this point in time, because that's extremely important. As important as vaccination is in our COVID-19 response, equally as important at this point in time is our continued practice of the measures for self-protection, which includes sticking to home and as close to home as much as possible. So, I encourage people to get vaccine when, they're able to do so, but to aim for staying as close to home as possible, minimizing their interactions and their excursions to the extent that that can be limited to what's essential. And then the more we're able to do that, the more that each and every one of us does that, the sooner we will get to the other side of this pandemic.
And just as a follow-up to that, it doesn't sound like the province can keep track of who gets vaccinated abroad. Are you optimistic that maybe more people have been vaccinated here than we know about? Because some people, including potentially a huge number of snowbirds, have been immunized in the U.S.?
Yeah, so I imagine that has happened, that there are a number of snowbirds who probably had the opportunity to get vaccinated while away. I trust that at some point we'll be able to collect some of those data. I figure that those snowbirds may have opportunity to connect with a healthcare provider at some point in the not too distant future and inform them of that. That data may then be able to be recorded somewhere. So I expect that there are some people who are not recorded in our COVAX system because they did not receive their vaccine here. And certainly that vaccination still provides the protection to that individual and to those around them.
Oh, we got a question. Could you just repeat the question, Mr. Mayor, just for those who couldn't hear?
The question was to do with the wagering that is happening as between the Mayor of Montreal and myself with respect to the upcoming hockey series. I should say, first of all, I was very proud to raise the Toronto Maple Leaf flag at City Hall today, and that is meant to wish them good luck on behalf of all Torontonians, but including myself as a lifelong Leaf fan as mayor. And I did have a delightful conversation with the Mayor of Montreal, Valerie Plante, and we agreed that we would have a wager on this historic series. First time in 42 years these two teams have met in the playoffs, notwithstanding the rivalry that goes back decades and decades. And we basically bet bragging rights at big city mayors meetings, which is probably the most important thing, that the loser will raise the winner's flag in front of the City Hall, which I'm sure she'll be delighted to do, for we'll send the Maple Leaf flag for that, and that we'll share a little bit of food and beer, in her case some smoked meat sandwiches coming our way, and if in the unlikely event that we're having to send food, it will be some pea meal bacon sandwiches from the St. Lawrence Market together with some local beer. And finally, and perhaps most importantly, we will each make a donation to the charities run by these two hockey teams that support people in our respective cities. But I'm looking forward to an exciting series, and it is great to have Toronto and Montreal, two of the long-standing rivals that many people remember from years gone by. And there were two series where they took us out 4-0, the last two in 40 years ago. We're going to be making up for that starting Thursday night.
Okay, great. Thank you. Thanks for the question, Chris. Thank you all for joining us. That concludes today's briefing. Because Monday is Victoria Day, there will be no briefing. The next scheduled briefing will be 1 week today, when the Leafs will likely sweep the Canadiens. Thank you all very much, and stay safe.